Many years later, at 89 years of age, Norman Vaughn decided that he was going to climb that peak. Now the problem is Norman Vaughn had, at that point, really bad heart disease and really bad lung disease. And his family said, you can't do it. And he goes, I'm doing it. They go, you'll die. You won't even make it to the base of the mountain. Don't even go there. You're dead. You won't, no. He said, I'm doing it. So they relinquished and they sent 2 guides to carry his dead body home. Norman Vaughn made it to the base of that mountain, and Norman Vaughn summited that peak. And when he got to the top of the peak, his 2 guides that were 50 years younger than him said, how did you do this? I mean, we're supposed to carry you home dead. And he looked at him and he goes, you know, don't believe the negativity. And if you dream big and you dare to fail, you can accomplish anything and everything in life. It's time for every person in this room, every American, to dream big and dare to fail. Because if we do, government, pharmaceutical companies, HMOs, and insurance companies will not be empowered, and your healthcare freedom will be restored. There are a number of things you can do. There are websites that Ron has written down for you to look at. It's important that you take this message and you bring it to as many people as you can. I'm not going to tell you who to vote for and who not to vote for. I think you can guess that I will never vote for anybody in 2010, 2012, or 2014 that voted for this mess. See, I believe all those people that voted for this are oppressors. They're not freedom fighters. They need to be defeated. They need to go away because it adversely affects every person and family and business in this country. And truly, I believe, affects the future of our country. Dream big. Dare to fail. Don't buy into the negativity. And believe in yourselves. Our country rides on it. Thanks for taking your time to be here tonight.
Thank you, Dr. Janda. We're going to move into some Q&A. Rhonda's going to take that side of the room, I think, I hope. So if anybody has any questions for Dr. Janda?
I've got one here.
Don't start the answer until you repeat the question. Those in back cannot hear the people in front when they give their question.
Okay. Anybody? Oh, here we go.
Hello.
Hello.
Quick question on HSAs.
Yes.
I appreciate you mentioning those. Is there any part of the healthcare reform that affects the longevity of that program or
Yep.
the availability of that?
The answer is, did everybody hear the question? Yeah. HSAs are, I'm not going to say eliminated in Obamacare. They are hampered. Many of the non-prescription products that you could buy out of an HSA program and use for your, out of your medical IRA can no longer be purchased. In addition, they have it so that if your employer changes your coverage and you are forced to, if you had an HSA before and your employer says, I'm no longer going to offer that product, we're just going to offer these other products that are approved by the government, your HSA becomes a taxable entity that's taxed at your level of income. So what they try to do is essentially a very quick, I'm not going to say gradual phase out, but a very quick phase out. And if, you know, the statistics are that, you know, 14 million people are going to be forced out of their current program into another program, those folks that have HSAs will have a taxable event on the money in their HSAs. They are not well liked. Now, look, I can tell you, I had a direct, I mean, you can't get any more direct than this. As I point out in my book, I've been thrown out of the White House twice in my career. One under George I and one under good old Bill Clinton. George II never asked me there because I was seen as a disloyal individual because I was willing to question statements that were made and how they were made about health care. But I did have a conversation with Dick Cheney, who actually I found to be a no-nonsense guy who, and they tried to do some things with HSAs, but as I pointed out to Vice President Cheney, there's one thing going through the motions, the old talking the talk and walking the walk. And as I pointed out to him, you got to quit talking the talk and walk the walk. They never walked the walk. They really could have done a lot of other things and built upon the Dole experience that they never did. So both entities have been guilty of not pursuing what Dole had set in motion back in the late 90s. Obamacare takes a whack, though, at HSAs to get rid of them because they don't want competition. They don't want a program that empowers people. That's what it comes down to, unfortunately. Some people say to me, Dave, can you please point out one thing that's positive about Obamacare? So here it goes. The Medicare trustees that are in charge of Medicare did an analysis recently, actually in August of this year, and they concluded that the unfunded liability of Medicare with Obamacare will decrease by 2029 to $31 trillion from previously projected $37 trillion. Isn't that nice? I mean, let's face it. We got 31 trillion sitting around. It's no big deal, right? But then here's the interesting thing. So that a bit got shot to heck because Richard Foster, who's the Medicare actuary, so he's the big numbers guy in charge of Medicare, he said the trustees' conclusions were bared little, if any, relation to the real world, and the trustees' estimates do not represent a reasonable expectation for actual program operations in the short or long run, and that Medicare's share of the economy will rise 60% between 2010 and 2040. Well, so much for my optimism that they were going to cut the unfunded liability by $6 trillion. The bottom line is that when you look at the facts, the really hard facts, it's really hard, and understand something. I've advocated, there are some people who say, you don't want health care reform? Oh, come on, I put my life on the line for 20 years on this. I've advocated for health care reform, but real health care reform that empowers people. I'm not going after this because it's changed. We got to have our health care system that's more available, more affordable, more quality oriented, but this does none of that. And what really bothers me is that a lot of the stuff that we're fed are not facts. It's just rhetoric. It's just made up. It's just wrong. It's vapor. And that's, question everything I gave you tonight. Go to big government site. Look at the numbers I have. Look at the references. All this is referenced. Read my book. Look at that. I encourage you to question. I encourage you to do more research on this. But I also encourage you to let others know. Let others know. Yes?
Doctor, given the courts, their incline toward not, going with laws that have been, with legislation that forces people to do things, Do you think there's any chance that we would get a decision to make this unconstitutional?
You know, I'm a doc, not a lawyer, thank God. I'll tell you this much. Oh, yeah, this sounds bad. I have very little faith in our judicial system. I'm a bad guy. I really am for saying that. I think when we have to trust a bunch of judges to do the right thing, I think we got problems. And I'd like to think that they'll look at the facts, that they'll really look at the Constitution. Because, again, I'm not a constitutional scholar, but in really smart people that are constitutional scholars I know, they think that there is a real constitutional issue here. I'm not convinced that a high court, let alone the Supreme Court, will rule in a way that I might believe would be the right way.
Maybe we'll get a 5-4 decision.
Well, you know, we can hope, and but I do think it's important to go after this in a number of different ways. I think just to say, well, I don't really like the system, so we're not going to pursue it. I think it needs to be pursued. You know, today there was a trial down in Florida where the 20 attorney generals, of which Cox from up here was one of them, the judge is going to make his decision in 30 days, whatever that means. And my guess is whatever that decision is, it will be appealed, and then that will be appealed and eventually go to the Supreme Court. But how long that's going to take, I can't help but believe, knowing the legal system, that it's not going to be before January 1st, 2013. I want to tell you one other thing, and I was negligent about mentioning this. I mentioned Thad McCotter. The reason why I'm such a fan of Thad is that I've dealt with a lot of folks in politics in D.C., and I wish I could tell you that they really like to hear from us. A lot of them don't. They see us as a money pit that just keeps feeding them money, and that's where our role starts and stops. He's different. And he said to me, he goes, what can we do legislatively on this? I go, let's defund the rationing board and the enforcement board. So he and I wrote a 2-page bill, H.R. 4500, that has been introduced, and it's in the process of getting sponsors. I encourage you to tell your friends and neighbors from as far around the country as you can to tell your congressman to support it. And what it does is it dingle. What it does is it defunds the Federal Coordinating Council for Comparative Effectiveness Research, and it defunds the National Coordinator's Office for Health Information Technology. It takes the $2.9 billion and puts it back in the Treasury to pay down the deficit. Not that it makes much of a difference, but at least it's something. You see, the key with this is if you cut its heart out, it dies. If you cut its rationing board out and its enforcement board out, it's dead. It just goes right to the heart of it.
Is that what Boehner's talking about?
And the Boehner's talking about a little something different. There's a motion to dismiss that's being advocated by Steve King, another freedom fighter. He's out of Iowa, and he's gaining support of something that essentially would clamp it down. This is something that's specific. I mean, this is like what the motion to dismiss is. It's analogous to carpet bombing an enemy. What McCotter and I did is a cruise missile that goes right in the front door of Saddam Hussein's palace. Okay? And in other words, there's not a lot of collateral damage, but it's dead.